President.
Senator from Missouri.
Mr. President, I want to talk for a few minutes today about health care and more inquiries I've gotten from the people I work for in our state about health care. And like we always do, I've followed up with them to verify that I understand their account, and they don't mind if I at least mention their first name and where they're from as we talk about these problems. I had a chance this morning, Mr. President, to speak to the American Federation of Hospitals about the challenges we face, and mention to them a comment I made on the floor here just a few days ago, which was if we were dealing with this healthcare debate today, it would be, in my view, a much different debate. Every member of the House, every member of the Senate, and almost every American that's been impacted in any way by the changes in healthcare understands this a whole lot better than we may have understood it 4 years ago. I was in the House in 2009 and was leading our effort to come up with the alternatives that were clearly out there that I think we could have and frankly should have pursued. But at that time, it was clear that a lot of members hadn't really thought about this, and the people they worked for, in many cases, had thought about it even less. We had a situation that in many ways was an accidental development at the end of World War II, where most people in America got their insurance at work that had insurance. The people that had insurance at work liked what they had, and of course, among other things, hoped they'd be able to keep it. And hopefully many of them will, but clearly many of them won't. The letters I've got today are reflective of all kinds of challenges that that people are seeing. You know, one of the things that actually was working very well in the almost 40 states that had it was the high-risk pool, where people that had pre-existing conditions had a way to get insurance. They were in a pool that was pretty well defined. Not everybody with a pre-existing condition, Mr. President, had an ongoing cost. You might have a condition that was under control. You might have had a heart problem or a cancer problem or another problem that stood in the way of you getting other insurance, but it didn't mean you had a lot of ongoing cost. It did mean that that high-risk pool was a place you could go, and in our state, the premium for people in the high-risk pool was 135% of what everybody else was paying. So what everybody else, the average rate that people were paying for insurance, add 35% to that. But remember, these were people that everybody understood, including them, they had a pre-existing condition, they had a place to go. And if the new plan would have reduced that 35% back to what everybody else was paying, that might have been a worthy goal, but that doesn't appear to be what's happened at all to the 4,000 people that left the Missouri high-risk pool when it was ended because of the new law on December the 31st of last year. There was a transition for some of them. Here is one, Bjorn from Kansas City said his wife was previously insured under the Missouri high-risk pool for pre-existing conditions, in her case a back condition. That was canceled in the middle of 2012, and she was put in another high-risk pool that the law allowed to happen as a transition. Now, the problem that created for them was it reset their $1,000 deductible, so they met the $1,000 deductible in the high-risk pool, and they met the $1,000 deductible again in the second half of that year. Now the insurance that they've been able to find cost them 4 times what they were paying before. It's not 135% of the old premium. I guess 4 times that would be it'd be 550% of the old premium. So somebody that was paying 135% of what used to be the normal premium for an individual is now paying 550% of what used to be the premium for the old individual. If that was the way to help people who had a pre-existing condition, they'd better hope that the federal government doesn't try to help them anymore. Mark from Parkville says his 2 sons, young and healthy as they were, according to him, both just increased a 20% increase in the policies they had. The only reason they were given was that the new requirements of the Affordable Health Care Act meant that their their premium would go up. Mark says he lived out of the country for 2 years and was amazed to find upon his return that the same type of health coverage he had before he left, his cost would go from what had been $250 a month to now $1,000 a month. Bill from St. James, Missouri, his deductible went from $1,000 to $2,500. Mr. President, in Missouri and West Virginia and lots of places, you and I know that if the individual deductible is $2,500, a family looks at that, and for many, that's just like not having insurance at all. If a couple of you happen to get sick that year, it's suddenly $5,000. I met with some Missouri hospital folks last week in St. Louis. They said their fastest growing uncollected debt was now among people with insurance. Now, why would that be? Because it's among people with insurance who suddenly have a deductible that is much higher than the average person with insurance used to have. And so the point they were making was people can't pay the $2,500 or the $3,000 or the $5,000 or even higher deductible, so that part of the bill just doesn't get paid. That's the new growing debt that hospitals have. Now, these people that have the high deductibles are insured maybe for lots of things they didn't used to be insured for, but they don't use any of the things that they're now insured for that they didn't used to be insured for. And so Bill from St. James says, Obamacare sure has not helped us. I work for a small business that has renewed my health care, and my deductible has risen from $1,000 to $2,500. My visits went from $20 to $30 in the copay, and the specialist copay went from $50 to $75, and he doesn't understand how he's helped by the new health care law. Carl in Lee's Summit, Missouri, said he has type 1 diabetes, and his deductible went up to $7,500. Again, for most families, a $7,500 deductible is like not having insurance at all. If we could go back to where we had the health savings account, where you had a high deductible and you had your health savings account, and that high deductible could kick in only if you had to pay the high deductible. I never saw a health savings account plan that wouldn't be cheaper than these plans that cover a lot of things, but they cover a lot of things a lot of people don't need. Carl says, to keep my premium rates down, my employer had to raise our deductible to $7,500 with no prescription benefit, so that now instead of putting away $400 per month for my retirement, I spend it on insulin and diabetic supplies. How is this ACA helping any honest working American who's trying to take care of themselves and not rely on the government? Carl's point is the money he used to spend to prepare for his own retirement, he now spends to pay for his insulin and diabetes medicine that used to be covered until this year by his policy. Christine from Kansas City said her husband's employer was forced to make changes in their insurance, resulting in a deductible that went from $1,300 to $6,100. Now, if this had been the way we would explain this, that somehow, let's assume we were even insuring more people, which there's no reason to believe that yet, but let's assume we were. But we're insuring more people with, what have I had here today, a $7,500 deductible, a $6,100 deductible, a $2,500 deductible. She says our deductible went from a manageable $1,300 to a devastating $6,100. I recently sent in prescriptions from my doctor and can't imagine how much they will be. We were told they would be between $25 and $200 depending on the cost of the drug. And remember, they're all before you get the deductible. Fred from Columbia. A drug company that makes one of his prescriptions no longer offers him a discount. The pharmacy told him it was because of the Affordable Care Act. Now, I'm perfectly willing to believe that the Affordable Care Act has become an excuse for some things. This may be one of them. I haven't talked to the pharmacy here, but I do know that these are problems that other individuals are having because their insurance doesn't cover what it used to cover. Fred's a retired state employee, and his plan, he just says, just doesn't offer as much coverage as it used to. Houston and Shirley from Peculiar, Missouri, have a supplemental health insurance. Their supplemental health insurance increased by $333 since the Affordable Care Act was passed. They say their policy increased $149. This is their supplemental policy. Senator Blunt, they say, we are on Medicare and have a supplemental health insurance. Our monthly premiums were a little less than $165 prior to the ACA's package. Now, as of January 1, 2014, they're $498.48. Our premium has increased by $150 a month, and that's from supplemental insurance. And just last week, Medicare Advantage, one of the ways that people in underserved areas, whether they're inner cities or rural communities, the way to encourage that competition was reduced as well. I would just say, Mr. President, that if there was ever a time that we should take a second look at something, and the facts that every one of us have in our office that would suggest we take a look at it and even demand we take a look at it, it's this policy that's hurting Americans, that's hurting families. And Mr. President, if we had this debate again, the country, the healthcare providers, and the Congress of the United States would be a whole lot better prepared to talk about what needs to be talked about than apparently the Congress was prepared to talk about in 2009 and 2010. And I would yield the floor.